staff and management of CWM Hospital, invited guests, media partners, Nisambula Vinaka, a very good morning to you all. Indeed, delighted and honored to be here with you this morning at this very important handing over ceremony over the donations provided by the International Women's Association. Before I move on, allow me to echo the sentiments of our MS, Dr. Fong. Yes, many a times we are so much committed with the things that happen around within the health ministry and within our facilities that we sort of tend to ignore the generosity that our partners, NGOs and other organizations try to bestow upon us. But thank you for pushing for this, Judy. I was also copied in on the emails where you push for a date, and I think we have a date today. Yes, so thank you very much, and thank you, Bashir, and your staff for organizing this morning's activity. So I'd like to start by saying, can we put our hands together to thank the International Women's Association, their president, and the representatives present here this morning. Judy, to you and your team, thank you very much for your unwavering commitment, generosity, and wonderful support provided to the development of health services in Fiji, and especially to your generosity at CWM. I'm particularly enlightened with the fact that this assistance is coming from a women's organization. And that being said, I'm very much part of advocating for women in leadership as being a great source of strength and foundation for the development of not only our families, but our nation and the world alike. So there goes women power. Extremely pleased to say that International Women's Association is a living testimony of that. And we once again convey our sincere acknowledgement to Judy for her exemplary leadership and commitment in steering the vision of International Women's Association to reach out and create opportunities for the empowerment of women, children, and the underprivileged, of course. The assistance you and your group has provided to the Ministry of Health and Medical Services over the last 5 years is a reflection of your passion and commitment to contribute towards the improvement of people's livelihood and welfare, therein empowering them to reach to the maximum potential in lives. And I'm sure your kind donation and generosity will touch many, many lives, many of Fijian people's lives. I'm also informed that the International Women's Association visited CWM's Hospital Children's Ward in 2016 as well. And during this visit, they were made aware of the challenges faced with the provision of adequate equipment for the treatment and monitoring of the children who are admitted at the hospital's children's ward. In response, the International Women's Organization proceeded to raise funds to purchase the much-needed equipment which will enable our medical professionals to efficiently and diligently provide the healthcare services at CWM Children's Ward. The total value of the equipment donated today is $90,000 Fijian dollars, and these include, as mentioned, one neonatal warmer, a machine that will be used to warming of critically ill babies and is very important for resuscitation. 2 high-floor machines with accessories of humidifiers and nasal foams. These machines are critical care life-saving machines and are used for assisted ventilation of very sick neonates when stepping down from full ventilation. And of course, one phototherapy light machine used for jaundiced babies. And 6 breast pumps, 3 electrical and 3 manual. I'm sure you're all aware these are used for extraction of breast milk for feeding neonates, and 15 packs of bags and masks equipment. These are, of course, life and death resuscitation items used for very sick newborns who require help with breathing. In addition, ladies and gentlemen, to the above, the International Women's Association has generously sponsored the painting of the family room and nurses' tea room. I think much to the delight of our nurses, and the upholstery works on the benches for patients and relatives, something that we seem to have ignored and neglected in almost all our facilities. During my visits, I am actually shocked and saddened to see the state of some of the furniture that we provide for our patients who visit our health centers and hospitals. And believe me, this is a priority for me. And we are very shortly going to actually we have already embarked on this project where we are going to improve these very basic facilities for our patients. That should have always been a priority. I'm sad to say we've neglected it. So our divisional medical officers are working with our SDMOs to ensure that these areas are addressed before July in most of our facilities. And I'm looking for a completion report to see how well we have progressed. On that, ladies and gentlemen, coming back to today's program. The total costs for purchasing and bringing the equipment to Fiji and painting and upholstery works done is about 103,000 Fijian dollars. For that, we are indeed very much grateful, and we accept your generosity with open arms. Thank you very much. To the staff of CWM ward, please make good use of the equipment provided and ensure that it is properly maintained. The new investment will, of course, significantly assist our doctors and nurses in providing more advanced and enhanced care to those children who are admitted at the children's ward, and also the renovation will provide a more appealing environment for the patients and staff who access these facilities. It is my vision that we make our facilities as appealing as we can. A small paint work here, a little bit of renovation here and there goes a long way. Because we don't want people who are already sick entering our facilities, which gives them a very gloomy environment. We need to create these happy environment facilities when you walk through the door. And of course, it's not only the physical structure and environment. The happy faces of our staff is also very important. Somebody once said to me, when you walk into a hospital facility, you want to be greeted by happy-looking staff. And I'm sure the smiles of you nurses present here this morning is a joy, not only to the parents, but to the little children that you look after. So keep up with that. And if you think there's some room for improvement, I'm sure we all can do that much. A smile doesn't cost as much, okay? And nurses, you've chosen to be nurses, so I'd also like to plead to you to keep up that smile on your face that will work wonders for your profession and also work wonders for the patients that you serve. Ladies and gentlemen, it is also important to note that in 2015, similar assistance was provided by the International Women's Association for the CWM's Accident and Emergency Unit. The Lao Ward and the Vesesi Health Center, 19 medical centers in Fiji were also equipped with reproductive healthcare equipment, along with the establishment of the International Women's Association Wellness Center, previously known as the Oxfam Clinic, has since been renamed. The building was totally renovated and fitted with new medical equipment, furniture and fittings. And again, this project was made in collaboration with Suva Business Community, where about $150,000 of hardware and services was donated. Ladies and gentlemen, accomplishing these projects takes as a step forward to achieving the overarching vision of building a healthy population, and of course one which needs collaborative approach. As such, we thrive on public-private partnership to help us maximize the development opportunities in providing the healthcare that every Fijian truly deserves. As a ministry, we take great pride and honor in nurturing such partnerships of this nature, which brings hope and prosperity for our people, and it also helps us to map the way forward to strengthen partnerships and take our health services to even greater heights. On that note, I'd once again like to thank the International Women's Association, President Judy and your team, and if you can, please convey my appreciation and the appreciation of my staff, the Permanent Secretary and the MSs here, to all your members for their tremendous support in assisting us build Fiji's health services and take it to another level. I also convey my best wishes to you and all your members and congratulate you for the numerous achievements and hoping for your continued support in the future. Thank you very much. Similarly, to all the staff, the doctors, nurses and staff of CWM, thank you for your day-to-day services to individuals and families, and our mothers especially, who visit your unit. I'm sure you do your work with much enthusiasm and dedication, but I'd just like to say a word. We face a lot of challenges within the health system, and you've been here more than me, and I'm sure you know the challenges that we face. At the headquarters level, we are trying to work very hard to ensure that we overcome these barriers and obstacles that continue to hinder the way we want to move with the health service. And under my leadership, I can assure you that I have an open door policy where I'm ready to listen to your challenges, and I'm ready to work with the team to see how best we can find solutions. So should you have issues regarding your unit, your hospital services, your heads of department are the best people to talk to, okay? I would like to plead to you to work together in harmony with your team and ensure that we work out solutions for the challenges that we face. No outsider is going to help us achieve or help us get that solution. Should you have issues, should you have challenges, walk through your channel of communication, and me and my peers and your hospital services deputy secretary, and I'm sure you're a very hardworking MS, we will see how best we can provide you with what you need, all within reasonable means, okay? So with these words, let me thank you once again, and I wish you all well. in your day-to-day operations. I wish you health. To all my staff, thank you very much once again. I wish you good health. And let us be that team of people that genuinely care for our Fijians, that genuinely want the health sector to move forward. Okay? Let us not be the barriers. Normally we blame outside forces for barriers. Let us not be that barrier that is not taking the health service forward. In your own small units, there's a lot of things you can do. Positive mindset, okay? Your commitment, your dedication, your inspiration or aspiration to move your units forward. Teamwork is very important, okay? So the very senior members within the unit, okay, you have your doctors, you have very senior nurses and staff. Please work together and ensure that your unit is the best unit within the whole of this facility, okay? So with these words, thank you very much, International Women's Association, your representatives. Thank you very much to the staff. MS, thank you very much. Yeah, I wish you well. God bless you.
This is to Madam Minister and this is